An estimated 80% of all strokes are preventable. The risk of having a stroke can be reduced by controlling modifiable factors.
You're down in the bathroom. Can we go smoke a cigarette? I really need one. But first...
So how was your doctor appointment yesterday?
It was horrible. He's just complaining about everything that I do.
Oh. What about the smoking? That's horrible.
It's just so hard to stop. You know, I just don't know what to do.
Yeah. Stop smoking! You know, I bet this doesn't do good for your blood sugar either.
Well,
since you're
you know,
diabetic.
I take all of these pills, so it just cancels everything out
That's
anyway.
not how it works.
Well,
That's not good for you.
but it's fine. I'll be okay. My cholesterol is just a little high, and you know, my lipids are a little out of whack, and
So don't you think you should stay on top of that? Take your cholesterol meds!
well, you know, maybe eventually.
What
But
about
I'm
your
young,
blood
it doesn't
pressure?
matter.
How's your blood pressure?
Oh, it's a little high. I, take the blood pressure pills, and then I take pills for the blood pressure pills. And
Yeah.
it's okay.
Of course. It just adds up. Do you take them like you're supposed to?
Well, sometimes when I feel like my blood pressure's high,
Take an extra
Yeah.
and just...
yeah.
I don't think that that's what you're supposed to do.
I-
Take your hypertension meds!
Here, if I want to eat some chocolate cake, I take a little bit more insulin, and it's all good.
Treat your diabetes! Eat more fiber! Exercise!
Let me take a selfie.
Many patients at risk for stroke are unable to recognize potential stroke. Patients and their families and the public should be taught the signs and symptoms of a stroke.
Let's go get something healthy for lunch.
Oh, okay.
Alright.
Whoa,
Oh, I don't think you should walk.
Okay.
I think you need to sit down.
it hurts.
Your head hurts? Oh, I think we'll do a stroke test. Can you smile for me? Your smile is crooked. And can you talk? Repeat after me. That today is windy.
Please?
Your speech is slurred. Can you raise your arms for me? How does your left side feel? Does it tingle? Yeah. I think we need to call 911. I think you're having a stroke.
Stroke victims may suffer from cognitive impairment. The best first aid is for bystanders to call 911. Operators can give first aid guidance and direct appropriate personnel and equipment to the patient. Pre-hospital care from EMS teams shorten the lag time between onset of symptoms and treatment for the patient.
911!
911, what is your emergency?
My friend is having a stroke.
Alright, what is your location?
We're in the Vista Ridge Mall in the south entrance lobby.
Are there any injuries?
Well, her face is kind of droopy.
Okay. Is your friend bleeding?
No.
Is your friend breathing normally?
Yes.
Alright, is she unconscious?
No.
Is she awake and alert?
Yes.
When did the symptoms start?
About 10 minutes ago?
Okay. Has she had any recent head trauma?
No.
The 911 operator asks for descriptions indicating a stroke.
Any loss of consciousness?
No.
Change in behavior?
No. Oh, yes. Yes.
Okay, what is that change in behavior?
Can't really, her speech is slurred. Her left side is tingling, and her head hurts.
Any confusion or disorientation?
Yes.
Dizziness, weakness, or vertigo?
Yes.
Difficulty moving?
Yes.
Difficulty using her hands, arms, or legs?
Yes.
Difficulty talking?
Yes.
Difficulty understanding?
Yes.
Difficulty seeing?
Let me see, hang on. How many fingers am I holding up? I think she said 6. I think she's having a problem seeing.
Okay, any severe headache?
Yes.
The 911 operator asks 3 stroke questions.
Does she have any new weakness on one side of the body?
Yes.
Does one side of her face droop more than the other?
Yes.
All right. Is your friend's speech more slurred than before?
Yes.
A potential stroke emergency is given highest priority. An ALS team with a minimum of 2 ACLS certified paramedics are sent. If travel time is greater than an hour by ambulance to the nearest stroke-equipped hospital, then air transport will be sent.
Okay, hang on just one moment. Let me dispatch advanced life support. Hold on. Advanced life support, this is 911 calling. We need an ambulance out to Vista Ridge Mall, South Entrance Lobby. We have a possible stroke victim. Alright. Alright, Logan. Yes, we have advanced life support on the way, but stay on the phone with me and let me get a little more information from you, okay? Has she had any past strokes that you're aware of? Alright, how about TIAs? Alright, any hypertension? Alright, diabetes? Any heart attacks or heart problems? Okay, how about atherosclerosis or peripheral artery disease? Alright, how about any bleeding disorders? Okay, recent surgeries? How about liver disease? Alright, is she taking any aspirin, anticoagulants, or antiplatelet agents? Okay, how about insulin? Does she take insulin for her diabetes? Okay, and antihypertensives for her high blood pressure? Okay, is she on any cocaine, amphetamines, or any other street drugs? Okay, how about excessive alcohol? Does she drink excessively? And when did the symptoms first appear?
Assessing the time of onset of symptoms is crucial. Thrombolytic agents must be given within 4.5 hours of onset.
10 minutes ago, alright. And has she recently had any head trauma or injury? Oh, you hear the ambulance now? Okay, alright, well just stay on the phone with me till they arrive, okay? Alright.
A written record of 911 collected patient data must be forwarded or faxed to the receiving hospital emergency department. EMS teams must follow written protocols. Assessments and patient information must be documented on pre-prepared forms. Orient the patient.
Hi, I'm Carrie from ALS. What seems to be your problem today?
Open my arm.
I think she's having a stroke.
Okay. I have a headache. Alright.
Airway, breathing, and circulation are first priority. Patients with ischemic strokes are responsive and breathing autonomously. Those with hemorrhagic strokes can deteriorate quickly. EMS response teams must be alert to sudden changes in breathing and complications.
Can you stick out your tongue for me? Open real wide. No gag reflex.
Are you going to save my friend? I think she needs to go to the hospital.
We're on our way there.
Heart rate is 70.
Are you having any problems breathing? Okay, let me check the respirations.
Yep.
Respirations of 8. Breathing problems.
Level of consciousness is characterized as alert, reacts to painful stimuli, verbal stimuli, or unresponsive.
Tell me if you feel this. You don't feel this? Alright, how about this? And this? You feel this? Okay, good. Let's take a look at your eyes. If you could just look right here for me, please. And this side, look right here for me. Alright.
Blood pressure is 220 over 100.
EMS personnel should not treat hypertension in stroke victims. All documentation must be given to the receiving hospital upon arrival.
Has she fallen today? Any head traumas at all?
No.
No? Does she have hypertension, diabetes?
Yes, yes.
Yes, and
She's had cholesterol.
okay, high cholesterol. Is she on medication for that?
Uh-huh.
Okay, and headache you said?
Yeah.
Take your blood sugar.
Hypoglycemia mimics stroke symptoms and should be treated.
Blood sugar is 150.
Okay.
Simple stroke assessments such as the Cincinnati Pre-Hospital Stroke Scale is
Can you
used.
show me your teeth? And hold both arms out in front of you. Okay. Can you repeat, today is windy?
Today's cold.
Today's cold. Alright. We're going to transport you to the hospital, okay? Can you bring in the gurney, please?
EMS responders maintain constant communication with the receiving hospital. Assessment and patient information is relayed to the hospital's acute stroke team. The stroke team also provides the EMS responders with advice on the necessary placement, size of IV access, and treatment of complications. Other pre-hospital care include oxygenation to treat hypoxemia, establishing an IV access, administration of IV fluids to treat shock or dehydration, and placement of a 3-lead EKG in order to monitor the patient's heart for arrhythmias, myocardial infarctions, and to screen for cardiac causes. The patient is transported once stabilized.
Okay, we're ready to go.
EMS teams are taught by nurse educators. The educator must conform instruction to the local regulations and be aware of which hospitals are capable and equipped to treat strokes. Teaching objectives must emphasize immediate stroke care in specialized emergency departments, that strokes are given the highest priority, that EMS teams use written checklists and protocols, that simple stroke assessments are used, the time of onset of symptoms are obtained, that EMS should know the closest acute stroke hospital, that EMS should maintain constant communication with the receiving hospital. Usually EMS teams deal with only 4 to 10 stroke patients in a year and require refresher courses twice a year.